good morning. My name is Andreas Feyler. I'm a traditional acupuncturist at Cheshire Natural Health. I'm also a senior lecturer of acupuncture and Chinese medicine at Glyndŵr University, affiliated with the University of Wales. Here at Cheshire Natural Health, I mainly do the traditional acupuncture, which means that after a thorough consultation, looking at a patient's tongue, feeling the patient's pulse, I would choose some acupuncture points that are not only local, as in this example of a hay fever patient, but also some distal points, which means on the acupuncture channels, on the arms and on the legs. Some of the acupuncture prescriptions that I use at this practice here at Cheshire Natural Health have been used for about 2,000 to 3,000 years. And they are useful in a variety of treatments such as back pain, sciatica, arthritis, but also we are treating a lot of conditions of chronic imbalance such as chronic fatigue, allergies, infertility and many more. Today I would like to demonstrate a typical treatment. In particular, today we have a hay fever situation, and I will demonstrate some of the typical points and the procedure that I do. Claire, could I see your tongue, please? Yeah. Okay, thank you. And I feel your pulse as well. Okay, thank you. I'm going to use some points now. Okay, a typical point that we use for hay fever is found right between the eyebrows. It's very effective. Another important acupuncture point that is used for the treatment of hay fever is found right next to the nose, and it's located right here. As you might be able to make out, the needles are very fine. They're only 1/4 millimeter thick. Most people don't actually feel them at all. Do you feel that?
I thought that would hurt, but it didn't hurt at all.
Okay. I usually treat bilaterally, which means I choose points on both sides of the body. So in this example, I will choose the corresponding point on the other side, which is found right here. Okay, how was that?
That's fine, yeah, didn't hurt at all.
A special aspect of traditional Chinese medical acupuncture is that we choose acupuncture points that are not only located in the area of discomfort, such as in this example where we have hay fever symptoms, or primarily in the sinuses, in the eyes, in the nose. We also choose points that are located, for example, on the feet. The reason for that is because most acupuncture channels, they start either in the face, under the eyes, and finish at the toes. So in this example, I'm choosing a point that is located at the end point of the channel that starts under the eyes. Okay? The channel that starts just under the eyes is located and finishes at the second toe. So I'm going to choose the acupuncture point on that channel, which is right here. And that will significantly improve symptoms of the eyes and nose.
No, you don't really feel this at all. It's surprising because you would expect that you would, even if it is really thin, you'd still expect to feel it, but not at all.
What most people don't realize is the actual size of the needle. They are only 1/4 millimeter thick, which is about the size of a human hair. Hence, most people don't actually feel anything as the needle goes in. The needles that I typically use are sterile and single-use needles. They are pre-packed in a sealed pouch, and it's important that they are never used again and never have been used before. So each time I check that the pouch is not broken, I would take the needle out, check that the needle is intact, put it into my guide tube. After having found the acupuncture point, I would put the needle with its guide tube on the point, hold it with my guiding hand, and quickly flick it in. And again, most people will find that as not painful at all. After about 20 to 25 minutes, I would remove the needles in this fashion, and then they are properly disposed in a medical sharps box, never to be used again, in here. And similarly, I would remove the needles from the face. I will dispose them in the sharps box.
I've been coming for acupuncture for the past year. I tend to come a couple of months before my hay fever season starts, so about March, April kind of time. So I've just started coming again this year, and I will carry on throughout the hay fever season. And although it doesn't cure my hay fever, it greatly alleviates my symptoms, so I'm not sneezing as much, and on days when I would usually suffer very, very badly when the pollen count is very high, I feel fine. Andreas really puts me at ease, so when the needle's going in I don't feel anything at all. It's completely pain-free, although even though the needles are the size of a hair, you would still expect to feel something, but you don't at all. It's a very relaxing experience, and I would definitely recommend it.